Now, do you have sensitive eyes and find them watering a lot? Well, Dr. Jennifer Hui of Desert Doctors is here to teach us about the common causes of eye tearing and treatments. Long time no see.
Hi, how are you?
I'm well. Welcome back to the show.
Thank you for having me.
So this is important stuff we're talking about, and in fact, I think that I might have these issues.
Okay.
So how common is tearing?
I think it's a very common problem. I'll have patients come in and they've been suffering for years. They'll bring bags of drops and different remedies they've tried. They've been told they have dry eyes or maybe they have allergies, and everything they've tried doesn't work and they're exasperated, so they come to us. And there's a variety of reasons besides dry eyes that can cause the tearing. Common ones are that you have some sort of outflow obstruction. So you think of your tear system like the plumbing in your kitchen, for example. If the pipe under the sink, which is your duct that goes from your sac to your nose, is blocked, then the water will fill in the sink and spill out of your eye. And it's, it can happen randomly. There's no known cause sometimes, and the duct is just less than 1 millimeter wide, so it's very easy for it to become occluded.
Right.
And that's a fairly common reason for tearing. And it's just a simple procedure in the office to diagnose it, and then we can go into further detail in the office about how to treat it. Other times the causes are congenital issues, so I'll see children and babies. Other cases that I've seen are a result of previous traumas or previous eyelid surgeries, including cosmetic surgeries, where perhaps your eyelids don't close all the way, and then therefore your eyes feel dry and your body's trying to compensate and it makes extra tears. There's a variety of reasons for tearing, not just dry eyes or a plumbing problem per se.
So like allergies, this is something completely different.
Allergies do cause tearing, and I see it around this time of the year. So we're in around October and usually April. I'll see a lot of people come in with tearing, itchy eyes. Sometimes the dermatitis of the lids, or lids are itchy, scaly red. That's also a cause of tearing, but the other causes of tearing are year-round. They can happen anytime to anyone.
Right, with a number of reasons.
A number of reasons, like we talked about.
Yeah. Tell me about treatment.
So the treatments, if you have an outflow obstruction, there are different surgical procedures to help you bypass the blockage, but you have to come into the office so I can check your tear system, and I flush some water down your tear duct and I see where it goes out or comes in, and then it tells me where the blockage is and how I can fix it. Other times, if it's allergies or some sort of reaction, there's drops we can try, sometimes some pills. And for the people who don't close all the way, perhaps another surgical procedure to correct the closure of the eyelids, realign them. Perhaps that's needed to help you with your tearing.
Okay, so as far as ages, I would imagine this could affect anybody and everybody.
Anybody.
And that's true.
Yeah, in my practice we see infants all the way through people in their 90s. So in the infants, it's usually a congenital issue. All of us are born with a fine membrane at the end of our duct. So it's like if a tissue somehow got into the drain pipe under the sink and it just never dissipated before birth. All of us have a membrane, but usually by birth it just kind of dissolves. In a small percentage of children it doesn't dissolve. And so therefore the water just can't get down the pipe.
Yeah.
So usually for the first year of life we'll have the parents massage behind the bone and push on the tear sac, and sometimes the pressure from the fluid being pushed will just cause the membrane to dissolve on its own. But after a year, if it hasn't gone away, it probably won't go away on its own. It's just a surgical procedure for the baby, maybe 30 minutes long. We put the baby to sleep, and then we probe through the tear system, and we just kind of feel our way, and I'll find if there's an obstruction and I can get through it. Sometimes I leave tubes in the tear system if necessary to keep the system open. So for example, if you had a blockage in your pipe under your sink and you use a snake and you go down through it and you feel it and it's just tight, maybe I'll leave the snake or the tube in there for a few months just to keep it open. Then we take it out and everything should flow freely.
I love the detail. You painted a great picture right there. Well, if you have issues with this, common tearing, I think a lot of us do, you can find Dr. Jennifer Hui in Palm Desert. Give her a call or visit her office at 41990 Cook Street, F1007 is the suite number, or palmspringseyelidsurgery.com. Big thanks to you, Doc.
Thank you for having me.
Of course. Big thanks to you. We'll see you after the break.